Good morning. Good morning. It's so great to see you all here today. Welcome to the Fielding School's inaugural Research, Innovation, and Impact Day. I'm Ron Brookmeyer, Dean of the UCLA Fielding School of Public Health, and really thank you for joining us today. This year, our school is celebrating its 60th anniversary, 6 decades of impact on public health education, research, and practice. So today is an opportunity to inform and have conversations about some of the tremendous and impactful work going on in our school. We have fascinating expert presentations and Q&A panel sessions planned, and it's our hope that they will provide opportunities to spark new conversations and maybe even new collaborations to address some of the most critical public health challenges that we face. And the presentations today and panel sessions are organized around 5 pressing themes that were identified in our school's most recent strategic plan: infectious diseases, health equity, communicating public health, big data, and climate change's impact on public health. Now, also today on display in the lobby are the finalists of our school student impact poster competition. And students will be standing next to their posters during the lunch break, so please be sure to stop by. And I hope you'll stay with us throughout the day, including joining us at the Court of Sciences at 3 p.m. at the conclusion of today's event for our school's 60th birthday celebration for light refreshments. Now, before we get started with the program, I have some important thank yous. First, I want to thank the incredible support of the Fielding School of Public Health Board of Advisors. Many members are here with us today. Thank you for all you do. I also want to thank the many people in attendance today who've made extraordinary and generous gifts to create fellowships and endow faculty chairs and advance public health research and expand our community partnerships locally and globally. Now, this year, we've also been fortunate to have a number of people and organizations make major sponsorship gifts in honor of our school's 60th, which allows us to put on events such as this one and advance critical school initiatives, including investments in the excellence of our faculty and students. Thank you for your generosity and incredible support. I want to thank our program committee who put together today's 5 panel sessions, Professors Sudipto Banerjee, Ann Pebley, Tom Rice, Xiaofeng Zhang, and Yifang Zhu. I'd also like to thank our event planning team and everyone who's worked so hard to make today possible. It's amazing when you get into this how many details need to be done to pull off an event like this. And I'd especially like to thank Jennifer Powers and the Development and Alumni Affairs team, Janet Hung, Rebecca Wolf, Carla Denley, and the Marketing and Communications team. And last, but certainly not least, a very special thank you to Professor James Macinko, who is our school's terrific Associate Dean for Research and a professor in the Departments of Community Health Sciences and Health Policy and Management. James, it's been truly my privilege to partner with you in making today's event a reality. And so without further ado, please join me in welcoming Associate Dean James Macinko.
Thank you so much, Ron. It's really great to be here with all of you today and to celebrate the incredible work that's done here at our school. Before we dive in, I just want to give a few programming notes. If you haven't already accessed the program, you can do so using the QR code, both on the screen. They're also posted around the auditorium. I'm going to ask you to please put your phones into silent mode. Today, we are also recording the event, and that will be made available later on the school's YouTube channel. In terms of the program, let me just give you a layout. Each moderator is going to introduce each of the different panels. The expert panelists will speak on the topic for not more than 7 minutes. Then we're going to have a Q&A. So the Q&A, the way we've kind of organized it in this room, is that the moderator will call on you. raise your hand during the Q&A session. They'll call on you. Please get to your question so that we can have a robust and interesting conversation. We've also built a break into the program today in this morning session, as well as a little bit of a longer lunch, so that the kinds of discussions that are started don't have to stop today. So I'm excited to really kick off the program, introducing our first moderator for the panel addressing infectious disease. Please join me in welcoming my colleague from the Department of Community Health Sciences, Dr. Michael Prelip.